Hey guys, hope you're doing well today. In today's video, we're going to look at two very popular medications and compare them to each other and see which one might be the best one for you. If you're struggling with type 2 diabetes or want to lose some weight, you're definitely going to want to stick around to the end of this video to see if Ozempic or Mounjaro might be a better medication for you. Over the past year, the medications Mounjaro and Ozempic have taken the pharmacy world by storm. I get calls all the time for people looking for Mounjaro or Ozempic, asking how much it costs, does my insurance cover it, and what do I need to do to try to get this medication, and is it the right one for me? We're going to look at some of that today, and hopefully by the end of this video, you'll know if Ozempic or Mounjaro is a medication that you need to ask your doctor about. Both Mounjaro and Ozempic are GLP-1 agonists, and the simplest way to explain the way these work are when you eat a meal or eat something that's high in sugar, your body's blood sugar rises. GLP-1 agonists work by increasing the amount of insulin your body produces, therefore lowering your blood glucose level. These medications lower your blood glucose level, which makes them a very popular treatment in type 2 diabetes. Both Mounjaro and Ozempic are FDA approved to treat type 2 diabetes in adults. But if you've been online recently watching TikTok videos or YouTube videos, or even saw some celebrity interviews, you've probably seen the increase in popularity of Ozempic and Mounjaro for weight loss. And it is true, these medications are very effective in weight loss, and with most people taking it, they usually see a drastic decrease in their weight. But they haven't been FDA approved for this purpose. There is another medication called Wegovy, and it is FDA approved and marketed for weight loss, and it has the same active ingredient that Ozempic has in it. But we'll leave that medication for a different video. The first drug we're going to look at today is Mounjaro. Its generic name is tirzepatide. Mounjaro is a once weekly injection that dosages range from 2.5 milligrams up to 15 milligrams. So you take your prescribed dose once a week. The Mounjaro pens are single use. 4 of them come in a box, and you use one a week, so that box will last you 1 month, and once you use the pen, you throw them away. Also with the Mounjaro pens, the needle on the pen is already attached, so you don't have to worry about attaching the needle before you give the injection. The next medication that we're talking about today is Ozempic. Its generic name is semaglutide. These pens range from 0.25 milligrams all the way up to 2 milligrams per dose. Ozempic comes with pen needles in the box. You have to screw them onto the pen, and then there's a dial on the back of the pen you twist to adjust it to the dose that you're currently prescribed. Once you give the injection, you take the pen needle off, throw it away, and then hold on to that pen and use it again for next week. So one pen generally will last anywhere from 1 to 2 months depending on the dose that you're taking. But all of them expire within 56 days after the initial dose, so 2 months is the max you can get out of one pen. Now we'll look at some common dosing schedules to compare Mounjaro to Ozempic. As you can see with both medications, you generally start with a lower dose. This gets your body used to the medication and keeps you from having some of the common side effects that we're going to talk about later. And then each week while you're on these medications, you'll take the same dose for 4 weeks, and then if your A1C is still high or your blood sugar is still high or you're not losing the weight that you want, then your doctor can increase your dosage and you can go all the way up to the maximum dose for each, which is 2 milligrams for the Ozempic and 15 milligrams for the Mounjaro weekly. So does Mounjaro or Ozempic work better when treating type 2 diabetes and decreasing A1C and decreasing fasting blood glucose? Let's look at this randomized control study. It included 1,897 patients who were randomly distributed to either taking Ozempic once a week or Mounjaro once a week. And this trial lasted for 40 weeks. So looking at these lines, the gray dotted line you see is patients that are on 1 milligram of Ozempic a week for the duration of the 40-week period. The 3 blue lines that are below the gray line are patients who are taking different strengths of Mounjaro once a week. And the Mounjaro strengths ranged from 5 milligrams, 10 milligrams, or 15 milligrams a week. The results of this study showed that Mounjaro once a week had a greater efficacy in decreasing hemoglobin A1C, as well as decreasing fasting blood glucose for these patients. In the same study, the weight of the patients was also tracked, comparing Mounjaro to the Ozempic. As you can see from the graph, the gray line again is the Ozempic, the three blue lines are the varying strengths of Mounjaro, and the patients who are taking Mounjaro had a greater decrease in weight from start to finish as compared to the Ozempic. The study also looked at side effects. So with any medication, the better it works, usually the more risk there are for side effects. So if you look at this study, the patients who are taking Mounjaro had a greater occurrence of severe serious side effects when compared to the Ozempic. 5 to 7% in the Mounjaro group saw serious side effects, whereas only 3% in the Ozempic group saw serious side effects. The most common side effects seen in both groups were decreased appetite, nausea, vomiting, and diarrhea. Now let's compare the cost of Mounjaro versus Ozempic. Both Mounjaro and Ozempic can be covered by your insurance company. Now it's best to call your insurance and see if they cover either one and what their stipulations are on getting coverage for these medications. From what I've seen, especially in the past month or two, insurances are really only paying for Mounjaro or Ozempic if you are diagnosed with type 2 diabetes, and they are requiring this diagnosis code to be on the prescription. If your insurance will cover it, it still sometimes can require a prior authorization. What a prior authorization is the doctor prescribes a medication, the prescription gets sent to your pharmacy. When we bill the insurance for this medication, the insurance comes back and says, hey, a prior authorization is required. We then fax that to the doctor. The doctor fills out a form, sends it to the insurance. Then the insurance decides if they want to pay for the medication or not. And then once they approve or deny it, they usually will either notify us at the pharmacy or your doctor or the patient themselves, and then we can proceed to bill the insurance if it is covered. Just looking at an overall cash price for Mounjaro versus Ozempic, Mounjaro usually for one box, which lasts a month, costs anywhere from $1,000 to $1,100 a month if it's ran strictly on cash with no insurance, whereas Ozempic costs anywhere from $900 to $1,000 a month. So the Ozempic is slightly cheaper than Mounjaro, but not by much. There are some coupons available for both Mounjaro and Ozempic that can get the cost down to as low as $25, but there are a lot of stipulations on this. Usually they need to be covered by the insurance first, then the coupon can be added onto that to get the price down. I know that when Mounjaro first came out, there was a coupon that you could get from their website that got your price down to $25 a month. Whether you were taking it for obesity, diabetes, it didn't matter. You could get it for $25. This is not really the case anymore. Starting around June or July of 2023, the most I've seen the Mounjaro coupon pay is around $500, and most patients copay with just the coupon is around $550 to $600 a month. So the coupon really isn't working the way it was when it first started out, but it's still an option that you can use to get your medication a little bit cheaper if your insurance doesn't cover it. So if you stuck around to now, we're going to compare these two medications, Mounjaro and Ozempic, and look at a chart that I've made to kind of highlight some of the main similarities and differences of the two. Both Mounjaro and Ozempic are a once a week injection. The difference with them is the Mounjaro pen, it comes with 4 pens in the box. Once you use the pen, you throw it away, get a new pen for next week. The Ozempic pen, you screw the needle on, use the pen, and then you take the needle off, keep the pen. Next week you use the same pen with a new needle, and you keep that pen for the month. Dosage for Mounjaro is from 2.5 milligrams all the way up to 15 milligrams a week. Usually you start out on that lower dose, and as your body builds up tolerance to the medication, and if you need the increased lowering of your A1C and blood glucose, then you can go up on the dose all the way up to 15 milligrams. Ozempic is titrated up the same way, but its dosaging ranges from 0.25 milligrams all the way up to 2 milligrams a week. So in the study we looked at, we saw that Mounjaro was better in lowering A1C, lowering fasting blood glucose, as well as lowering weight in patients that were taking Mounjaro versus Ozempic. The Mounjaro was the clear leader. But along with the better efficacy, also higher side effect profiles were seen in patients taking the Mounjaro, and the Ozempic was tolerated better. So both medications work, but the Ozempic does see a fewer occurrence of side effects. And lastly, the cost of each is around the same. You're going to be looking at basically $1,000 a month for either one with no insurance. Like I say, there are some coupons available, but you need to look on their manufacturer's website to see the stipulations of those. And I would also encourage you to call your insurance, talk with your pharmacy and your doctor, and see which one may be the best choice for you. So that's it for today's video. I hope it was helpful. I hope you can kind of see some of the similarities and differences of both Mounjaro and Ozempic and see which one might be the best one for you. If you have any questions, just leave them in the comments below. And if you want to know more about Ozempic and what you should expect when you're taking it, click on the video that pops up. I dive into a few things about it and discuss them further. Thanks.